knock. Hello. My name is Alejandra and I'm going to be your student nurse today. I'm going to be doing your postpartum assessment. Is that okay with you? All right, great. I'm going to look at your name band. Okay. All right, I'm going to start off.
Wait, pause, stop. We're going to start over. I'll edit this out. She should at least be in a
Like a more
this up position.
Well, should we keep her flat?
No, because your patient will never be flat in the hospital,
That's true.
and then it's a point to make the bed flat in the assessment.
That's true. That's true. Good thing for checking her name band.
Yeah, because it's not on the list, and then when I was doing it, I should, just in case.
I'm gonna put you flat.
Okay, introduce ourselves, then I take.
She has no name band,
listen,
does she?
That sounds.
No, she doesn't.
But you don't have to check.
No, it doesn't say on the thing.
Yeah, that's what I thought too. Okay, let's go whenever you're ready.
Oh, good. Okay, take two. Knock, knock. Hello, my name is Alejandra, and I'm going to be your student nurse today. I'm going to be doing your postpartum assessment. Is that okay with you? Okay. I'm going to be checking your name band to make sure I have the right patient. All right, I got it. So I'm going to start off by listening to your chest. So I'm going to listen bilaterally, side to side. All right. Also going to listen to your vowel sounds. Just going to open you up a little bit. On this side. Listen to the 4 quadrants. Okay, great. I'm going to take your vital signs. So we're going to do temp, pulse, respiration, and blood pressure. And that's all within normal range, so that's good. Have you had any pain? Okay. From 0 to 10, 0 being not at all to 10 being the worst ever, what would you say it is? A 9? Okay, so for a 9, I would recommend like a heating pad. A heating pad is something that you can put specifically if you're having cramps or contractions. That's pretty normal, but that will help with the pain. All right, then I'm going to move on. That's okay with you. I'm going to check your breasts. So I'm going to open you up a little bit. And then I'm going to, in a circular motion, move around the breasts, palpating, making sure there isn't any warmth, any redness, drainage from the nipples, that they are intact. There isn't any tenderness, or at least a lot of pain. That all looks within normal range, so that's good. All right, I'm gonna move on to your uterus. So with one hand, with my left hand, I'm gonna put some pressure on the pelvis. With my other hand, I'm going to check for your fundus. And it is firm, it's midline, and it's at the U, umbilicus. If it were to get soft or boggy, or if you felt like excessive bleeding, you could massage your fundus when you feel that, and that will help decrease the bleeding and help it contract your blood vessels. Okay. So now, for your last bowel movement, when was that? 2 days ago? So that's fairly normal after giving birth. I would recommend ambulating as well as having a high fiber diet. Make sure you're taking a lot of fluids in, and that'll help ease that process as well as help with any hemorrhoids or anything like that that you might have. For bladder, when was the last time you went to go void? About 4 hours ago? Okay, so you should be voiding about every 2 hours. That will, if you wait too long, your bladder becomes very distended, and that can displace your uterus, which would cause some bleeding. Okay, so that's something else that I would recommend. Do you have any signs of a UTI? Have you had any burning when you go pee? Any foul odors? Any pain? Anything like that? No? Okay. And something I forgot to ask beforehand is if you've been passing gas. Okay, great. All right, so now we're gonna talk about your pads. So I'm just gonna look here again. When was the last time that you changed your pad? Okay, about an hour ago? Okay, it's very good. Before doing this, I would put gloves on just to make sure that we're clean. So for about an hour ago, your bleeding is about a light rubra, and there isn't any foul odors or any clots, so that's good. Okay, I'm going to step on the other side. I would put that rail up. So I'm gonna have you sit that way. Okay, so I'm gonna check for any epidural. Look at your epidural spot, and this I would check for any Rita. So Rita stands for redness, edema, ecchymosis, drainage, and approximation. So it's looking clean and it's looking good. I would also check your bottom. So I would uncover you, making sure that if there were any lacerations or anything, I would also use Rita to check that. And that's all looking appropriate. Okay. Okay, so throughout the assessment, I've been able to see that the patient is cooperative. They've been looking towards the baby. They have that connection there, and she's been talkative as well. For a mom that's had a C-section, I would check her IV, make sure it's patent, make sure that the order is still in place, that there isn't any signs of infection like redness, warmth, or pain at the site. I would also check if they have a Foley on the bed, making sure it's patent, there isn't, that the urine is looking yellow. I would note the amount, making sure the order is still valid. And lastly, I would look at the incisional site to make sure that it's dry and intact. Also, a big thing to make note of is DVTs. So for DVTs, I would look for any unilateral swelling. So let me look at your legs real quick. All right, so they're looking equal, so that's good. I would note for any redness, any warmth, any pain in the calf, anything like that. If you were to note that, you would need to let your nurse or your doctor know. I would let you know that ambulating decreases or prevents the cases of DVT, so that's important to look at. All right, then.